I'm pleased to have with us Linda Coccola, who is the Chief Communications Officer and Executive Administrator for the Reliant Medical Group. Welcome.
Thank you for having me.
Linda, you know, for some people, Reliant Medical Group may seem like a somewhat new name, but actually it's an organization that's been in this community for a long time, previously known as the Fallon Clinic,
Exactly.
but with the changing landscape of healthcare and both locally and nationally, a few years back, new kind of organization, new name, and maybe you could just share with our viewers the significance of Reliant Medical Group and what it means.
So Reliant Medical Group is an integrated healthcare delivery system. We're a large system with about 2,600 employees. We have right now about 23 freestanding locations and a breadth of services from primary care to over 30 specialty groups.
Right, and those are in some case, you know, part of the 2,600 count of employees and jobs are doctors who provide, but then there's a whole back-end operation and a gamut of jobs that Reliant Medical Group provides.
Right, so we have about 500 providers, which is kind of a global term for physicians and advanced practitioners, but you're right, behind that there's hundreds of nurses and techs and all of the people that it takes to kind of deliver a comprehensive set of healthcare services.
And that's important when we talk about in central Massachusetts, the Chamber completed a study a couple of years ago that did an in-depth analysis of the Central Mass economy. And when you look at the four largest employers in the region, it's healthcare, it's higher ed, it's financial services, and manufacturing. And you know, certainly the UMass Memorials and the St. Vincent, all big, large employers, but Reliant is right up there in terms of a group and all different types of jobs.
Yeah.
Part of any business or organization is kind of branding and letting people know what you do, and Reliant recently has gone through a recent effort in that exercise.
Right. So we merged with Southborough Medical Group in January of 2015, and that was the impetus for us to kind of step back and look at our family of services and determine whether we're really putting our best face forward. Specifically, are we letting the world know all that we are and all that we do? Because we had some separately named subsidiaries. So our endoscopy center, for example, had its own name and its own logo, and our surgical eye department had its own name and its own logo. And we decided that we probably didn't look like as big and comprehensive of a system as we actually are. Could the world make sense of our system? So that kind of got us down the road to do some research and to talk to patients and community stakeholders. I think you were among them, and employees, hold focus groups. And it was pretty clear that we had an opportunity to kind of take all of our services and organize them better for the community. So we decided to put them all under just a bold, great new logo that is on buses now and things like that to get people familiar with it. But it just made sense to take the family of services and put them under one parent brand. And we think that's going to be better for the community and more intuitive experience for patients.
Right, so you know, when people see Reliant, they understand, as you mentioned, really the breadth of services that you provide throughout. And you know, that you mentioned integrated healthcare, you know, how that happens. So currently Reliant works with insurers and hospitals in a lot of different settings in providing that care.
Right, so we accept most insurances. People might remember back in the day when Reliant Medical Group was Fallon Clinic. There was a time in our history when if you went to Fallon Clinic, you had to have Fallon insurance, and if you had Fallon insurance, you had to go to Fallon Clinic. But it really hasn't been that way since 2004, or maybe even 2003 in that era. So now we take all payers, and you know, our services are open to pretty much any patient who would want to avail themselves of Reliant services.
Right, right. And so that process that you described in terms of talking with stakeholders, engaging with patients, you know, that's a pretty intense process. How long did that take?
We did spend a few months on it. I mean, we wanted to make the right decision. So we held focus groups with patients, focus groups with non-patients, so call them potential patients, community stakeholders, employees. They all had kind of a chance to weigh in on how we could put our best face forward, and in particular let the community know all that we do and all that we are, because some people see us just as a primary care, some people just use our specialists and they don't use our primary care, but we just found unanimously that we had this opportunity to take our family of services and put them all under the one brand, and then people can make more sense and really understand, as you said, the breadth of what we have to offer.
Right. And you know, in addition to being a very large employer, 2,600 jobs and families that are impacted in a positive way, Reliant's engaged and involved in the community in a number of different ways as well.
We
and
do.
give you an opportunity to kind of share.
Sure.
I was with you at one recent event we
right.
could talk about, but
So every year we sponsor between 80 and 100 events. We want to be part of the community. We actively look for partners in the community. We also have a foundation that is the charitable arm of Reliant Medical Group that gives grants out throughout the year, mostly to health-related causes. Childhood obesity is a big mission of that foundation, but also helps us at Reliant to fund some things that are not funded by payers. You know, rides to your doctor's appointment for seniors, for example, things like that. So we try to be very active and visible in the community. It's important. Certainly to our new CEO, Dr. Tarek Al-Sawi, has a very community-minded approach to things.
yeah, in the short period of time that Dr. El-Sawi's been at the helm, he's been out in the community, you know, meeting, engaging with stakeholders, and that is it's something I think that is important in Central Massachusetts, that you build those relationships and being, you know, the voice and face of Reliant. That's as much as part of branding, I guess, as logos and designs as well.
Well, he came to us from the Cleveland Clinic, but he quickly has made Worcester. He loves Worcester. I mean, he's, you know, exploring the city and the surrounding towns, loving the restaurants. So he became a fast resident of Worcester.
That's great, and I want to thank, you know, you and the Reliant group, medical group, and the foundation as well for your support. You know, the Chamber's run a program for 3 years now, which has been, you know, hugely successful. Really working with young people, many of them in our summer jobs program, from families that have some economic challenges. But we have a Worcester Leadership Institute, and Reliant, along with GFI partners, help put that summer program together. And we had the graduation just a week or two ago at City Hall for the kids who completed that program. Many of them going into their senior year or have recently graduated, the future leaders of Worcester, and just a great program. And thank you for being a part of that.
Great group of kids, and we can't think of a better investment than our youth. So thank you for allowing us to be part of it.
Yeah, well, one of the neat things about that program is we're able to take those kids on a Friday away from kind of their workplace, and they're nominated by where they're working because they show leadership potential, and get them out to companies like Reliant, to go to places like Unimore, let's go to City Hall and meet with the city manager. You know, they might live and drive by, you know, go by on the way to school, these buildings, but now they actually get to go in them and meet the leaders and understand and see that there are careers, whether they go into the medical field or not.
Yep, they spent a day in our finance department, and our financial analysts were just thrilled with the curiosity. They were industrious. They were excited. So it was a wonderful day for everybody.
Well, Linda, thank you for being with us, and
Thank
thanks
you.
for Reliant Medical Group for all you do and for the economy locally, and helping along the way in a variety of good causes. So